And these criteria are used to confirm or stage what joint hypermobility. So somebody's joints are so soft, the person can twist their hand like this. You understand that kind of thing? So sometimes people could actually heal such a person, but sometimes you having a joint that can be overstretched is actually a red flag. So this is the Brighton Criteria, the Beighton Score, and the Hospital del Mar criteria. So look at each one of them one by one. So you should know that the Brighton Criteria, the Beighton Score, and the Hospital del Mar criteria, they are all tools that are used to access what hypermobility. Okay, but they differ in scope. Okay, so in a summary, the Beighton Score is a simple screening test. The Brighton Criteria combines what the hypermobility that a person have plus other issues that a person will have. Okay, then the Hospital del Mar provides a broader approach. So Beighton Score, let's look at the Beighton Score. Yes, so the Beighton Score is a screening tool for generalized joint hypermobility, and it uses a 9-point scale and is based on 5 maneuvers. So let's look at it. What are the things they will check? Okay, so for the 5 things they will check, the first one is what? Passive dorsiflexion of the little finger. So if it is more than 90 degrees, the patient scores 1 point. Passive thumb apposition to the forearm, like you are bringing your thumb towards the forearm, like it looks impossible, but people that are having hyper mobility of the joints, they'll do it. If somebody's able to do it, they score 1 point. Elbow hyperflexion, hyperextension rather, taking your elbow to the back, like not the elbow to the back. See, can you see the way your elbow will stop, but then their hand will continue up? If they do it more than 10 degrees, is 1 point. Knee hyperextension, so your knee coming to the front. When your knee is coming to the front, the knee joint is made in such a way that what the mechanics will block that movement from going further. But these people, they can still bring their legs to the front up to 10 degrees. The forward flexion of the trunk with palms flat on the floor. So after everything, they will now what take up your score. Okay, so they'll do it what over 9. All right, over 9, because what I think you do it on both sides, the left side and the right side, all of that. So moving next, we will look at the Brighton Criteria. So Brighton Criteria 2 is used for joint hypermobility. So it combines Beighton Score with other things. All right, so everything we had in Beighton Score, you bring it here, plus arthralgia. So if there is joint pain for more than 3 months and the joint pain is in 4 joints or more than 4 joints, all right, then minor criteria, that's major criteria. Okay, like if the Beighton Score is more than 4 and there is joint pain in more than 4 joints, that's a major criteria. The person has what hypermobility. Then minor criteria is if the Beighton Score is between 1 to 3 and there's joint pain in 1 to 3 joints, not up to 4 joints or more than 4 joints, or maybe there's back pain for more than 3 months. So maybe there's dislocation or subluxation, soft tissue rheumatism, okay, myophrenoid habitus, skin abnormalities, and eye signs, varicose veins, hernia, a lot of things, right? Uterine or rectal prolapse. Okay, so diagnosis: if you find 2 major criteria, or if you find 1 major criteria and 2 minor, or if there's a presence of 4 minor criteria, fine. okay, you can now be able to diagnose. You understand that kind of thing? So that's it. Then we have the Hospital del Mar criteria. It's an alternative to what the Beighton score, okay, but the Brighton score is like their oga, if you notice, you know. So the structure is a 10-point scale accessing multiple joints, you know. So what are the things you access in this place? You access for thumb apposition to the forearm. So if the person is able to bring their thumb towards the forearm up to 21 millimeters is a point. Fifth finger dorsiflexion more than 90 degrees is a point. Elbow hyperextension more than 10 degrees is a point. Shoulder external rotation more than 85 degrees is a point. Hip abduction more than 85 degrees is a point. Then knee hyperextension more than 10 degrees is a point. Ankle dorsiflexion more than 20 degrees is also a point. So the maximum points that somebody could actually score here is what? 10 points. Okay, so I think that's what we have. All right, so these are all, you know, all the different, you know, criterias, or you could say scores that are used in what? Diagnosing, you know, joint hypermobility or staging it. Okay, it's not diagnosing, it's staging, right? Because diagnosing clinically, you can observe that somebody already has that issue. Okay, so that's what we